Just giving it a few seconds and then we will begin. All right, I think we can get started. So hello everyone, and thanks for joining today's webinar, NextGen and IMO Core, Simplifying Clinical Documentation for Clinicians. My name is Jordan Leibovitz, and I'm part of the marketing team here at IMO. Before we get started, I'm just going to go through a few housekeeping items. So this webinar is being fully recorded and will be available to you for future viewing. Throughout the session, all attendees will be in listen-only mode, but if you have any questions, please type them into the questions section on your GoToWebinar console. At the end of the presentation, we'll have a Q&A session, and we'll get to as many questions as we can, but if for any reason yours is not addressed, we'll be able to follow up with you after the webinar. So today we have two presenters speaking. Wendy Coos, she is the Senior Sales Application Specialist at NextGen, and then also Josephine Maza, who is the Senior Manager of Customer Support at IMO. So we have a few items on the agenda today, and we're going to talk about how IMO Core can help with clinical care, financial management, value-based care, regulatory, and then we'll have our Q&A. So without further ado, I'm going to pass it on over to Josephine, and we'll get started.
Thank you, Jory. Hi, everyone. So most of you who are joining us today have been partnered with IMO for quite some time and are familiar with our terminology. But to level set with everyone who is joining us today and those who are not yet familiar with the solution we provide for the NextGen EHR, IMO provides clinician-friendly terminology to help providers and all end users document with ease and specificity. We have over 5 million terms with the appropriate code set mappings in our dictionary that allow you to document diagnoses and problem records for your patients. We've had a very exciting partnership with NextGen throughout the years, and we're very excited to have Wendy here today. Thank you, Wendy, for joining us. As we've delivered our terminology via a template platform that has continued evolving over time. So while providing terminology to help you search and capture diagnoses, we've also enhanced our solution by providing tools to improve problemless management. So today we're going to show you IMO's latest and greatest platform called IMO Core, which now encompasses a positive impact on all 4 of those key components that Jordan mentioned in the beginning of the webinar: clinical care, value-based care, financial management, and regulatory guidelines. So let's start with clinical care. What we want to continue delivering to all of our clients is an easy way to search and capture something new for your patient's charts. So as mentioned, we provide clinician-friendly terminology that allows you to search, but what we're doing now in IMO Core is also predicting what you want to say as you start typing the text. So this can help save time during your searches. Once something is selected from the predictions, IMO will navigate you through what needs to be selected to get to the highest level of specificity. And then you can add that most specific diagnosis to the chart. What's also supported in IMO Core is searching for things that may not be seen or available in the ICD codebook, but we create a description for it and allow you to search for it, something like bilateral knee pain. Once you take action on selecting a clinician-friendly term like this, IMO will capture all the appropriate diagnosis codes needed. In IMO Core, we also want to make it very, very seamless and help you have less windows and pop-ups that you need to navigate through during your clinical workflows. So what we've done is incorporated the ability to document assessment and plan details right within IMO. So you don't need to go to a different location of your EHR. Wendy, I know you're very familiar with these particular workflows. Can you elaborate a bit on the value you see in having these available in IMO Core?
Yes, thanks, Josephine. So I think of this as an alternative to using the chronic condition template, especially for those of us that do a lot of chronic follow-up. I'm a nurse practitioner by trade. You've got your impression, your patient details, your provider details here. It's easy to navigate through, and it's just it's less navigation. And one thing that I want to point out for those of you that are using NextGen Mobile, we have our directed desktop that's coming out here soon. Some of you that have maybe went to UGM saw the directed desktop, where you're going to be able to click right in even these boxes here in IMO Core to give that narrative. So it's going to even more so make a seamless workflow.
Great, thank you so much, Wendy. Along with clinical care, so we just touched a little bit on adding new diagnoses and documenting for those diagnoses in the AP details. Along with providing value for clinical care, I want to touch a little bit on the Problemless functionality in IMO. So what we do now in IMO Core is take the patient's ongoing problem list and display it in an organized manner. So it's organized by the specialty that the problem falls into. What we're also supporting now in IMO Core is that if you are a particular specialist, such as an ophthalmologist, you may not want to scroll through this long list of problems to go see what's related to the eye. So specialty view is now also supported in IMO Core, meaning that if you are a certain specialist, such as an ophthalmologist, any problems related to the eye will automatically jump to the top of the list. Any specialties such as family practice or pediatricians, the patient's problem lists will still be organized, but these categories will just go in alphabetical order, how you're seeing it displayed here. So now let's get into how you can better manage the problem list and the tools that are provided in IMO Core to help clean up the problem list when needed. So Wendy, again, I know you're very familiar with these tools. Can you touch a little bit on the value of having some of these cleanup functionality tools in IMO?
Yes, again, this really streamlines the workflow. You know that without IMO, you have to go to the problems module to add, promote from your diagnosis. And also, if you want to update past medical history, you have to go into past medical history. IMO brings it together. You'll notice if, Josephine, if you'll go down to your history of abdominal hernia first, the problem at the bottom. One thing I want to point out is that this makes it easy to clean up the problem list. And if I don't want that history of abdominal hernia necessarily on my active problem list, but I do want it in past medical history. So I'm able from this screen to promote it to past medical history. So it will be there. And you know, that's good. It's documented. I'll have that to refer to later. And yet I've cleaned up my master problem list here. Another aspect of it, if you see under endocrine and metabolic that she has hypothyroidism and adult hypothyroidism, well, I want to clean that up. I want to merge those together. It's the same diagnosis. So I'm able to merge them together. Again, an easy, efficient way to keep that problem list cleaned. And you have history down there at the bottom that you merged those two together. And then the next, if we look at her diabetes type 2 controlled, IMO also makes it easy for you to follow the progression of a disease, whether they're progressing, you know, they're getting worse or they're getting better. So here for the diabetes, let's say maybe, you know, they've had diabetes controlled, they haven't had any end organ damage, nothing, you know, to date, but now this patient's seen ophthalmology, she's been diagnosed with retinopathy. So I want to change her diagnosis to diabetes with retinopathy. So I'm able to update the problem. And then if I look under history tab down in the bottom, history, go to the up to the history tab, I can see that progression. I'm able to follow that progression of the disease without having to go search through a bunch of different encounters and documents. It's all nicely contained right here in IMO. And in Josephine, if you'll go back to the notes tab, you're also able to add notes, that note that you want to add as a reminder so that when that patient comes in, you'll remember XYZ about this process, or I had them on this medication, they didn't do well, we changed to another medication. You're able to nicely see in reverse chronological order here those notes, whereas again, without IMO, you have a place to do it in NextGen, but you do have to go to that problems module to do it, so it's an all nice contained simplified workflow here in the IMO core.
Great, thank you. Thank you so much, Wendy. Now, let's go ahead and pivot to the second value of, or component that we had mentioned as value-based care in IMO Core. So what we've done in IMO Core is provide a much more concise and realistic tracking list of the patient's ongoing HCCs that exist on their chart. So within IMO Core, we are now looking at what exists in the patient's billing history list and in their problem list, normalizing that data so that we know if something's on the problem list and it's a SNOMED code, what's the appropriate ICD-10 code that tells us if it's an HCC. And that normalization that we do in IMO Core allows us to keep track of every HCC that exists on the patient's chart. And each HCC is tracked under the HCC category that it falls under. So this particular patient that we're looking at has 4 HCC categories that are being flagged. I'm going to go ahead and address one of them for today. So the controlled diabetes with retinopathy. What IMO is going to do is navigate you to get more specific when further specificity is required for these particular guidelines. So because of now this is diabetes with retinopathy, we need to specify the insulin use, the retinopathy severity, macular edema, and the laterality. So now I have that extremely specific HCC diagnosis added to the patient's chart. And I'm now down to 3 HCC categories. And I want to call out as well that this very, very specific diagnosis that I just documented for the patient now is always maintained on this patient's HCC list. So in the future, in subsequent years, when I'm flagged again to address this particular HCC, I can take action on the one that is already very specified. Now getting a little bit into financial management. So within IMO Core, we give you the ability to take action on historical diagnoses. So we do provide the billing history. One thing to ensure that financial management is kept under control within your organization and to help with some of those pain points is to always ensure that you are getting the most up-to-date codes in IMO and that you're not selecting anything that's outdated. The way we do that is each time you take action on a historical diagnosis within IMO Core, there is a lookup done, a quick lookup off of our portal service that determines what is the most up-to-date code. So each time you're selecting something from the history list in IMO Core, you can ensure that that lookup is happening and that the most up-to-date code is being added. This also ties into regulatory updates and having a smooth regulatory update each year. So regulatory was just right around the corner for all of us on October 1st. Lots of new codes were introduced. Within IMO Core, In order to ensure that you are getting the most up-to-date codes and ensure that you are staying up to date with regulatory, we automatically release those updates to you. And something like working from the IMO favorites list, we also ensure that you are automatically prompted to get the most up-to-date codes. Because chances are, if something has been in your favorites list for quite a few years, that code may have changed. It may have been updated in a recent regulatory release. One example is something like dementia. Dementia is what I have on my IMO favorites list. Just this year on October 1st, new guidelines were put into place that now you need to specify the severity of dementia, and new codes were introduced as well. I'm automatically being prompted to specify dementia severity. So now I'm capturing one of those new codes that was introduced just by taking action on dementia within my favorites list. So I'm staying up to date with regulatory guidelines. All right, and that completes the demo portion of the webinar today. So to recap on where IMO Core can provide the most value for your organizations. Jordan, I think if you have a screen share. Great, thank you. So to recap on everything that we can provide value for your organization's clinical care with a quicker and enhanced search experience, along with more provider-specific views on the problem list. Financial management to ensure you're capturing the most up-to-date and specific codes for billing guidelines. Value-based care with the more accurate picture of HCCs that should be addressed, and regulatory updates each year, which we will continue to be automatically providing, and they will always be available in IMO Core without any heavy lifting from any of your internal resources. And I think, Jordan, that's time for Q&A.
Yes, it is. And we have a few questions already that came in. So Joe, one came in, is it possible to hide codes so that they don't show up? So example, the ability to hide unspecified type codes.
Yes, that's a very, very good question. So we cannot hide unspecified codes from our content, as they do need to be available. Try to think of IMO as a web page that you are using, and if we hide certain things from that web page, it will hide it for everyone who's using IMO. However, there are definitely some things that we can help you to kind of navigate people to avoid those unspecified codes. We do have unspecified flags that can be turned on in the search results so that people are alerted when they're about to select something unspecified. There are also some things that we can do within your NextGen library. If a code is inactivated in your NextGen library, it cannot be selected in IMO. So that's also, an option that we could work together to talk about. Maybe if you wanted to inactivate something on the NextGen side, it would also not be actionable in IMO. Are there any other questions?
Yeah. So does IMO suggest codes that have not been used or that have been used not by our provider to close gaps in coding?
Can you repeat that question?
Does IMO suggest codes that have been used not by our providers to close gaps in coding?
I'm trying to go find that question. I'm so sorry. I am so sorry. I will follow up with that one.
Yeah,
I'm
follow up with them. Another. Okay, is it possible to hide codes so they don't show up?
Yeah, yes. So again, we cannot hide codes if they are active and billable codes that are in our content. We are unable to hide them, but certain things like unspecified codes, there are flags that we can enable to help end users know that they're selecting an unspecified code.
Okay, great. All right, so we have a new PA starting early next year. Can we preload a favorites list in IMO Core for them?
Yes, absolutely. So if you have new end users, PAs, providers, anyone coming on board that will be using IMO, we can preload a favorites list into their particular user ID. So we would just need one favorites list already created by someone in the organization, and we could take that and copy it to another new user.
Awesome. All right, will the IMO favorites need to be recreated if we upgrade to IMO Core?
No, the IMO favorites do not need to be recreated. If you are currently a user of Problem IT Plus and you upgrade to IMO Core, those favorites will automatically carry over.
All right. So there's quite a bit of questions that are coming in. How do you map text provider specialty to display the problem list appropriate for their specialty?
Yes, also a good question. So what we're looking at is the specialty that is selected within NextGen. So when you're starting an encounter, such as on the SOAP or the intake template, there's a specialty right there at the top of the template. That is what we are mapping and finding to identify the specialty that you are working under.
Okay. Does this mean that all providers should remove their generic dementia ICD in their favorites?
No. If you have the generic dementia in your favorites list, you should automatically be prompted to move forward with specifying that severity type and everything else that you need to specify with dementia, as long as you're using IMO.
Okay, great. One person asked if they can share this webinar with their providers who could not attend. Yes, there will be a recording sent to you this week, and you can forward along to your colleagues. All right, and then for the specified flag, is this functionality available in Problem IT Plus or only in IMO Core?
The unspecified flag is available in Problem IT Plus. It is a little small and that is nicely displayed in IMO Core, but it is available.
Okay, great. And then are there any other generic codes that need to be specified as of recommendations this year or next year?
So every generic or any very generic term that does require further specificity for billing guidelines, such as diabetes, gout, knee pain, those are just examples of things that very generic that you can find in IMO that do require further specificity. If they do, you will be presented with the drill down functionality that walks you through having to specify further. For all of those new requirements that were just released on October 1st this year, we do have documentation of all those regulatory changes. So we are more than happy to send that over to you of a list of all those new codes and new specificity requirements. So we can definitely do that.
Okay, great. All right, Wendy, this question might be for you, and it's a little longer. Do you have any recommendations on items such as PMH or, for example, status post-mastectomy, and keeping them out of the problem list? We always train the problem list as a whole health picture of those items that you want to be aware of quickly and instantly, and now wondering if how important it is to move that data to PMH instead.
Oh, well, I mean, I think that's I think that's up to the person. I think that's up to the provider if they want to move it to past medical history or keep it in the problem list. I'm one that I typically move my surgeries to past medical, to the past medical, past surgical history, but I think that's I think that that's up to the provider, in my opinion.
Okay, great. Joe, this one's for you. Do you use any algorithms to suggest HCC codes based on other codes that have been billed?
To suggest HCC codes, currently we do not have that functionality available, but that's great. Fantastic feedback, actually. So thank you for that question.
Oh, mark it down.
Yep.
All right. I think one more for right now. So is our specialty is ambulatory surgery. Can you add a subspecialty if the ASC is multi-specialty? So this might be for you both, Wendy and Joe. You want me to repeat the question?
So can you add a
so
go ahead, Jordan.
Our is ambulatory surgery. Can you add a subspecialty if the ASC is multi-specialty?
Yes, yes, you can. I believe I think I'm understanding the question of if you add a subspecialty, will IMO recognize it? And the answer to that is yes. And if it's something that we don't recognize, we will just display the problem list. How I mentioned that we display it for family practitioners or pediatricians, where the categories just go in alphabetical order rather than a certain specialty jumping to the top of the problem list. And if there's something that we're not recognizing, that is also something that we can address and fix in our service so that we do recognize it in the future. I hope I answered that correctly. If I did not, please feel free to.
Yeah, I think you did, and we'll follow up on the webinar.
Yeah.
So one more, our providers like to document a lot of information in the patient or provider plan. Are the text fields customizable?
Oh, yes, such a good question. They are. Very, very good news, and it's what's exciting about our partnership with NextGen, and it always has been throughout the years, is it's very customizable. Just like how your NextGen EHR is customizable, so is IMO Core. So we can move things around. We can customize text fields however you want them customized. We do just have only our pop-up window to work with. But if there were certain fields that you wanted much bigger, we could do that. We understand the patient and provider plan is a very popular place where most of the typing is done, and maybe differential diagnosis you'd want to make a little bit smaller. We can certainly, that is all part of support that we provide for your IMO Core implementation.
All right. So I think we're going to close out for today. Wendy and Josephine, thank you so much. We hope you found today's information valuable and useful. If you want to learn more about IMO Core, please contact your client executive or email sales@imohealth.com. I appreciate your time today, and I hope you have a great rest of your day.
Thank you, everyone.